everybody. This is Dr. David Gustitis from Whole Body Health Chiropractic, and I'm happy to present to you this month's presentation on how text neck affects your brain. There we go. All right. So I appreciate all of you who are attending and those of you who will watch this afterwards on our replay. This topic is super timely. It has been timely for decades now, but the reality is it's becoming more of an issue as more kids, more people use their phones and use their devices in such a way that it's shaping their bodies and shaping their health. Text neck, tech neck, or turtleneck syndrome. All of these are the different names that you might hear out there for the same basic phenomenon. What does it mean? It basically is the postural shaping of what happens, the body impact of using our device, looking down at our computers too long, head down like this. It creates a new shape of our spine that wasn't there before, and unfortunately, it's happening at younger and younger ages. So, what are the causes? It's kind of obvious. We all know this. We all do this. It's device usage, computer work, poor ergonomics at the work office, the workplace, and or slouching. When we are just sitting watching TV or sitting and talking. Device usage is up. The average use right now per day is 3 hours and 15 minutes. So that means some people are using it less, many are using it more, especially the younger generations. People check their phones on average 58 times per day. That's crazy. That's a lot of checking. 3 and 4 Generation Z members say they spend too much time on their smartphones, self-admitting that they do that. So another factor is sitting. So if we're sitting, we're tending to slouch and tending to look down more often than if we were standing. And if you're aware, the Surgeon General came out with a statement that sitting is the new smoking. People who sit all day have earlier death risk by 16%. That's pretty substantial. On average, daily sitting is about 4.7 hours, and 3 hours is what I said before, carries the same risk as if you were a smoker. So what is tech neck? We'll just go with tech neck. What does it technically mean? So it's several things. Prolonged neck bending, forward head posture, reversed neck curve. It can lead to neck, shoulder, or arm pain, muscular and nerve strain, pain, burning, numbness, or stiffness. It can cause headaches, vertigo, can cause tech neck lines, which are lines on the front of the neck because of having your head in that position for so long. It starts to create a crease or creases in the neck. So how does it affect the brain? So, what does this have to do with the brain? Typically people think of, yeah, it's just my neck or the back of my shoulders or my pain down my arm. Okay, that's terrible, but how does it affect the brain? Well, the reality is that when we move our head forward, we're actually straining, stretching the spinal cord and also all the nerves that branch off of it. This alters the quality of the neurological input into the brain. So if the brain is measuring and monitoring the position of our body all the time, and our head is now forward from our shoulders more often than not, then that also changes the type of input going into the brain all the time. But if that same nerve tissue, that the spinal cord and the nerve tissue that goes through the middle of the spine is being stretched, that can cause damage to that nerve tissue just by pressure on it, by stretching it, or by diminishing the blood flow to it. So if you stretch like this rope in this picture, the spinal cord, now there's more tension within the spinal cord, and it's more difficult to get that blood flowing into the nerve tissue itself. All the nerves, all the neurons, they require their own blood supply. And then within the spinal cord, there's also the cerebral spinal fluid circulation as well that bathes those neurons. So studies have shown that forward head posture affects several brain-based neurological functions. So what are those functions? So brain impact of text neck. Some of these are, I'll explain a little bit better, but most of them are pretty self-explanatory. So first of all, disrupted sensory motor integration. So up in the brain, you take in all the sensory input from your surroundings, you process it, and then you send out a reaction. That's the motor signal. So sensory signals get processed, and then we output with a motor signal. And the ability to integrate and process all that information gets affected, and it's been measured because of forward head posture, which is one of the consequences of text neck. Decreased nerve conduction velocity. So as we stretch that spinal cord, its ability to transmit signals is affected such that the signal velocity or the speed of those signals goes down. Decreased hand-eye coordination. So this is important for athletes. This is important for anybody just trying to coordinate their movements. Next, decreased ocular motor control. So that means the motor, the movements of your eyes. So when you're reading something, when you're trying to track or play a sport and follow a ball, like pickleball, which is popular now, or tennis or something like that, or basketball, or really driving, being able to track, an object. It's super important to be able to track your objects and move your eyes. It's not about the visual clarity and having the lens being transmitting the proper image. It's about your ability to track and to move and to follow along. So the biggest impact I can see for that is how it affects reading. So imagine if you have forward head posture and you're trying to read, you're actually affecting your ability to um, move your eyes across that page and do so in a way that is not difficult and that doesn't tire you out. Also, potential nerve degeneration in the spinal cord. Like I said before, if it's stretched all the time, it can have more likelihood of being damaged. Also, because of that decreased blood flow into the spinal cord, that makes a difference too. And then ultimately, possible decreased blood flow to the brain because there are arteries that run through the sides of the spine, the cerebral arteries, and those are put under tension. And it's been measured under an MRI in a small study listed here from the journal Brain Circulation that those who had a loss of cervical curve or loss of neck curve in that forward head posture, when their spines were corrected under chiropractic care, they regained between 25 and 200%. And they saw an increase in blood flow to their brain on this functional MRI. And that's a pretty fascinating study that merits further investigation. What does all this mean to your overall health? Obviously, when we're talking about brain impacts of text neck, that has an impact on your overall function because your brain controls everything in the body. Now, I use this image to portray health and portray how the body works in our practice. And why we do that, I'll show you now. So if you labeled all these different parts of this amazing tree with a powerful root system, look at the bottom. You can see lifestyle and environment. That's the roots of our health. Lifestyle and environment sends signals, information, and nutrients into our sensory system that processes that information and that feedback and stimulation and goes through our spinal cord, which goes down the middle of our spine up to our brain, and then from the brain out to our body systems, our organs, and ultimately our cells. And what we're talking about today is where the big arrow is pointing, the spine and the spinal cord, particularly in the neck. So what happens is if we have stressors in our lives, sometimes they're physical, sometimes they're chemical, sometimes they're emotional, those stressors, as opposed to the nutrients, those stressors can cause our body to get overwhelmed, overstrained, and then overloaded in such a way that it shuts down our ability to adapt and ultimately be healthy. So if you look at this summary of different physical, chemical, and emotional stresses, today we're talking about poor posture and alignment. You can see there's several other types of physical stresses, chemical and emotional, that we can talk about another time. So how can you prevent text neck? Well, as your parent may have said as you're growing up, sit up straight. No matter how many times they say sit up straight, it doesn't always lead to us actually doing it for very long. for many reasons, and I'll get into that in a second. But that's the simple thing is to realize, wow, we need to get the pressure off of our neck. So how can you prevent it? Well, we have to minimize the positions and the postures and the activities that are leading to that forward head posture. Um, for example, you see this person here looking down at her phone on the left and then looking more level uh, in a level position on the right. Um, that is a big impact, a big change to her neck curve. Now, however, look at her upper back angle. I drew that in red. You can still see that her upper back and her head is still forward, but it's not quite as forward as the first picture. I would recommend consolidating the number of times you check your phone, meaning don't check it every 30 minutes for a new email or checking it for a new update. Some of that stuff can become so addictive. Maybe put a timer on it. Say, certain times a day, I'm allowing myself to check it for new emails, for new texts, for whatever. Um, Hold your device at eye level, which we just covered. Take frequent breaks. So try to create a bigger gap between the times that you're using it. Or if you're using it for a prolonged period of time, because maybe you need to work on something or read something, then make sure you take breaks and don't just continually look at your phone without taking a break. You can lie on your stomach or on your back when viewing it. So if you're lying on your stomach, you're going to be looking up holding the device. That's a great one for kids. Instead of looking down, now you're forced to look up. Another one is lying on your back, and then you have your head touching the floor. It's kind of a lazier way of doing it, but you'd be holding your phone over your head as you're lying on your back. Position your computer screen at eye level, which might require some adjusting of your desk, of your chair, and then use an ergonomic desk chair with head support, something that gives you proper support that can go up and down to modify your eye level to your computer screen, and also something that has head support so that as you're sitting there, you're less likely to have your head going forward because you actually have a headrest that you can utilize. Support your neck, not so much your head with your pillow when you sleep. Why? Because if you're pushing your head forward, you're going to create that forward head posture. If you're supporting your neck, you can support that proper neck curve. We have a great pillow in the office that we utilize for those who sleep on their back. Ask me more about that later if you would. Slide all the way back in your chair when you're sitting, talking, watching something, or on a couch. So rather than this, you see the view on the right here, this woman looking with a proper position of their phone, but see how the angle of the chair pushes her pelvis forward from her shoulder position, and that creates the need for her head to go forward. Now, at that, creating that angle in her upper back. So if you can have a chair or a couch where you can slide all the way back so that your upper body is vertical, your torso is vertical, that will allow a chance for your head to be more vertical too. Lastly, elevate your books with a stand. So if you're in a class and you're taking notes, or if you're reading along with a professor, or you're, just reading, you're in your sitting room at home, and you're at your dining room table, prop up your books, put it up so it's again kind of like your desk, your computer screen. You're going to use something that's supportive of that book or that even iPad or some or device, but bring it up to eye level again. Now, what can you do if you have text neck symptoms? Well, what are some of those text neck symptoms? Neck or shoulder pain, reduced range of motion or stiffness, arm pain or numbness, headaches, TMJ, which is jaw pain. Like out in here, people have pain out in your jaw, difficulty when they're chewing, or just feeling tightness there, and fatigue. So a lot of these different symptoms can come from having text neck over a chronic or a long-term period. What else can you do? Okay, so if you have all those symptoms, now what are you going to do if you have them? Well, I can't emphasize it enough. You have to correct your posture because that's what's driving the problem. And then obviously looking at what's driving it. We went over that previously. What are some of the things you can do to hold your phone or your computer in such a way that doesn't keep driving the problem? But now you have, let's say, now you have the neck pain or the headaches or TMJ pain or the fatigue. Well, extend your neck and your upper body. So look at this picture in the upper right. See this woman who's on her yoga mat. She's pushing back, arching her upper back and her neck back. Spend more time in that position, extended rather than flexed. Do full range of motion, neck, and I put in parentheses, body exercises. But today we're talking about the neck. So if you just did full range of motion, neck exercises, what I'm looking at is ear to shoulder, chin turning over your shoulder, chin turning over the other shoulder, head down, and head back. And when you're doing your head down, you can hold your head and then almost imagine you're looking down into a pocket here. On the same side, on the other side, I mean, same thing. And all of those, hold it for 30 seconds. Okay, if you go left, hold it 30 seconds, right, 30 seconds, and so on. Those will help increase the range of motion of all the joints in your neck and help you maintain mobility. Motion is lotion, motion is life. And one of the things that we do when we're looking down our phone all the time, we're limiting the range of motion, partly because when our head is forward, just try this. Try to do all those same motions, left, right, rotating, rotating with your head jutting way out in front. And then bring your head back over your shoulders and do the same things and see if you notice a difference in the range of motion. I'll bet you notice greater ability to move side to side, rotating, etc., when your head is back over your shoulders. So make sure when you're doing those exercises, you're bringing your head back as far as you can to be over positioned over your shoulders as possible. Next, support your neck when sleeping. Even if you want to just lie down on the floor, roll up a towel, or if you're seeing a chiropractor, make sure you have what you see in the bottom left picture here, um, a neck orthotic called a Roll, which can be fitted for your spine based off of what you need and what your spine is indicating in terms of where it's lost its curve. Use a properly fitted neck orthotic, like I showed you there. Like I said, it has to be properly fitted. Have a chiropractic evaluation of your spinal curves and alignment. You can see in the bottom right here, see those all those lines that are red. Those are the indications of where the patient's curve is, and the green line is the normal line. So you can see how far off they are. The further forward the top of the line is from the green line, the more problems that person's going to have. And the more that curve is straight or going the other way, also the more likelihood of having those problems. Research showed that when the neck curve goes from that green curve to straight or further forward than that, people have an 18 times greater likelihood of having chronic neck pain in their life. That's pretty significant, 18 times more likely. We want to stay away from that as much as possible. And lastly, I mean, yeah, I'm a chiropractor. I recommend getting under regular chiropractic care. Why? Because you need to take care of your spine. You need to take care of your alignment. The spine is the only one you're going to have your entire life, and making sure that it's aligned, moving right, and not putting pressure on the spinal cord or on the nerves will keep all that beautiful energy flowing from your brain through that spinal nerve pathway the way it's supposed to out to your organs, your muscles, and all of your parts. It's just a fundamental need of the human body. And if you're having any of these issues, then those are warning signs that things are not right. And I would recommend getting things checked earlier rather than later because you can help yourself avoid future problems, future degenerative changes in not only your nerve tissue, as we talked about today, but also in your spinal joints, your musculature, and then your overall health as a consequence. So thank you for being here today. If you have any questions, please schedule a consultation. You can see our website right there. It has a link in order to schedule. You can follow that link from there. It's wholebodyhealthchiropractic.com. And also join us Tuesday nights in office for our weekly wellness workshops. They are in person. They're at our office in Vienna, 8391 Old Courthouse Road, Suite 350. And they are at 6 p.m. They go about an hour. All are welcome. So please reach out to us if you have questions. Otherwise, thank you so much for being here today. And I look forward to seeing you next month at our next advanced webinar.